And we're back, everyone. We're here at the Arthritis Broadcast Network booth at the annual scientific meeting of the Canadian Rheumatology Association and the Arthritis Health Professionals Association. And we're really pleased to be here this afternoon with Ahmad Zbib, who is the CEO of the Canadian Rheumatology Association. So I don't have to bow, do I? Okay, good. No. We did roll out the red carpet for Ahmad. So we're really happy that you're here. I guess this is your second annual meeting as CEO. So congratulations, surviving another one.
Surviving,
and thriving. Yes. Ahmad, I have to say, first of all, thank you for always rolling out the welcome mat for the patients who attend the meeting, the patient organizations who work together to put on our #CArthritis event. You guys have jumped into our out-of-the-box thinking about how patients could actually be knowledge translators in real time with a Facebook and Twitter live audience. So we're very thankful, and I'll get you on camera to say now you're going to invite us back next year.
Absolutely.
There you go, we're done. But I really want to talk to you today, this afternoon. You know, we're sort of halfway through the meeting now. The theme of the meeting, Building Bridges, I must say, has really resonated, not just with our audience, but it's been fascinating to hear our interviewees who have either presented or are presenting at the meeting, have shared poster work on their research. They've all found really interesting perspectives on and their views on what bridges they're building and in the directions they're building them. So I just wanted to ask you first. I know the program committee does, the heavy lifting on pulling these things together, but give us some insight on building bridges theme from the CRA perspective.
Yeah, and I cannot claim any credit.
Oh, I set you up. You could have taken all the credit.
Thank you. No, absolutely not. I think the committee's done a great job, and I was actually very proud of this theme because it spoke to me personally. And we're just chatting before we started, and I said, this is the a meeting ground for the rheumatology community.
Yeah.
This is where everybody's welcome. We want to be the ultimate host of the rheumatology community, and you do that by building bridges.
Yeah.
And also, this is such a flexible, as you mentioned, theme that you think about it from a patient perspective, from a shared care perspective, from a patient-centered care perspective.
Yeah.
No matter how you look at it, healthcare is siloed, and it's only by building bridges is that we're going to actually get to the other side.
Yeah, that's a good way of actually trying to describe patient-centered care. If there are no bridges, the patients could be in the center, but still very siloed.
Yeah, and it happens a lot because we talk a lot about patient-centered care, but it's still hospital and physician-centered care.
Yeah, no, that's a really good point. Your scientific program is built around the theme, and for you, when you look at the program as it's sort of rolling out, for you, what are some of the big kind of takeaways? Like, congratulations, you had Andre Picard give the keynote address. Mm-hmm. He said some really interesting things. I think most people kind of left it that, we've had all these reports, but not a report on solutions. Mm-hmm. So from a rheumatology perspective, what are some of the solutions you're bringing to bettering care for patients like myself and many who are watching?
Right.
Yeah.
So it all goes back to our mission, and our mission is first to represent the Canadian rheumatologist, and second and most importantly is to ensure that they have everything they need, and I'm paraphrasing, to deliver optimal care, right? So, and that includes education, that includes access and opportunity for research, that includes opportunities for networking, so the ideas and the great projects just find ground and fertile soil to actually build on.
Yeah.
So far, my takeaways, and I've also enjoyed Andre's delivery. And I'm with you. At the end, it was like, okay, so what are the solutions? But I remembered, investigative reporting is not really about providing solutions. It's about asking questions.
Yeah.
And I think that's what he excels at. Yeah. And it was phenomenal.
No, he's not. There's a reason he's the leading health reporter in Canada for so many years.
Exactly.
Yeah.
Yeah. And it also speaks to that nobody has a full solution for all the problems.
Yeah.
But there was a bit of a call to action is, let's think bold. Let's not just do things the way we've been doing. And I love that he mentioned, Einstein's comment, about definition of insanity, right? It's about time we think differently about the problems. And what the CRA is doing about that is, we're quite involved with the AAC. We're a primary funder of the AAC. We're funding some key projects at the AAC.
Let me decode Arthritis Alliance of Canada,
Right.
which is an umbrella grouping of
Right.
all of us together in the same room.
Right.
Yeah.
And, like the recent project that we also invested in, looking at the cost consequences of the models of care, that is at the heart of patient care delivery.
I
Right?
agree.
We're looking at how can we optimize a system that has a limited number of resources to deliver better outcomes.
Yeah.
So,
I guess it gives me a pause to say to our audience, because you forget these things, years go by, and the Canadian Rheumatology Association has been the primary supporter, one of them, of the Arthritis Alliance of Canada from day one. And our organization was really lucky to be at the table when we formed, as was the CRA and a couple of others. And I could tell you from an understanding perspective of what's needed for 6 million Canadians living with arthritis, the dial has moved. The models of care work that you so heavily invested in, both from an inflammatory arthritis perspective. You are the natural leaders of that work. Your membership drove that work. So, as patients, we're very thankful for that. Individually, I know we have massive hero worship of your membership, right? We all go into our rheumatologist's office, and by and large, we adore our rheumatologists because they spend more time with us than probably any specialty physician. They just roll up their sleeves and they care about us. We're a little concerned about the aging population of our rheumatologists. Maybe talk a little bit about that. What's the strategy of the CRA?
Right.
Are you going out and shackling interns and bringing them into, what's your strategy to grow the business?
There's a tiny bit of good news.
Okay.
It's not all fine and dandy, but
Yeah.
there's a tiny bit of good news. So the last survey we've done was a Stand Up and Be Counted at 2015.
Right.
And we looked at, do we have optimal coverage of rheumatologists? I think the formula is 1 rheumatologist per 75,000 population. And nowhere in Canada we had that number.
Right.
But we also looked back then, none of the, we were not filling all the rheumatology fellowship spots.
Right, in the medical schools.
Post residency.
Right.
So after they're done their internal medicine. So it was not as attractive a field. So the CRA has done a lot of programs, including the summer studentship program. We had some mentorship program. We had a Room Hero. There was a lot of campaigns that were done to actually attract rheumatologists, potential candidates into rheumatology.
Right.
And now all the spots are being filled by some of the best medical students out there. So
congratulations.
Thank you.
I mean, as a person who's lived with the disease a long time and worries about, when's my rheumatologist, I hope my rheumatologist doesn't go away before me.
Right.
That's fantastic news, and
now,
congratulations.
That's one angle.
Yeah.
And now you go on the floor and you see how many fresh new faces, and I love just looking at those young faces.
Yeah.
And, they're excited and they're here and they're participating, and we invest heavily in those, and we invite them to our conference. We cover their travel. We cover a lot because we know this is the future of rheumatology.
Yeah, the posters yesterday, just chock-a-block full of really bright, shining faces and really sharp minds.
Absolutely.
And lots of enthusiasm for kind of crawling around and looking at areas, researching areas that haven't been commonly researched.
Right.
And I think that's the goal. That's how you move the yardstick. When you think about the future and rheumatology, what is the CRA, what's the kind of 5-year plan, or what's the long shot vision that you have?
Yeah.
Because you bring a really cool perspective into the CRA. You've come from community.
Right.
You used to work at the Arthritis Society, so you bring that patient service lens to now, as you say, representing the rheumatology community, but then also figuring out ways to advance your profession to better serve those people you were serving at the Arthritis Society. So when you think long term, what do you see, Ahmad?
So we're in the midst of all of that because
Yeah.
this requires a lot of thinking. It requires a lot of careful analysis because you don't want to make or invest in resources that might not give you the best return on investment.
Right.
So there's a lot of work that we already started and work that we'll do within the next year or so to basically clarify what our next 3 to 5 year. Not a big fan of 5 years, to be honest with you.
Yeah, a lot changes in 5 years.
A lot of change, and most of the strategic plans that I've either been involved or not, they were so inflexible that by the time you're done 3 or 4 years, everything you created is
useless.
Yeah.
Yeah.
But we are still working on a vision, that flexible vision that allows us to constantly be adapting to the needs and wants of our members.
Yeah.
And the needs and wants of our members, it's not like the financial needs of our members. Our members have altruistic needs, and it is to deliver the best care possible for the patient. So our vision is to become an essential association for our members. They cannot imagine life without being a member at the association.
Yeah.
Because we want to create opportunities for them to be involved in research. We want to create opportunities for them to continuously learn. The rate of evidence generation has gone up considerably. It's impossible for one person to keep up with all the new things that are coming. So our role is going to be more amplified and needed going forward.
Yeah, as I'm listening to you, I was just reflecting back on my experience of the CRA over the years. And you have a research fund now that is supporting really important research programs, CIORA. And I don't think a lot of people, at the grassroots level don't know about that. And some specialty associations, such as the CRA, don't do that kind of stuff. But you guys sort of pull up your bootstraps and you say, we want to create an environment where research is part of what we're doing, not just membership representation and, rheumatology improvement in general. The other thing is you've been, through your board, through your presidents over the years, you've been really stalwart advocates and stood by patient advocates, which is very much appreciated. And I've seen the stature of the CRA grow. You're talking about it growing within your membership and it being thought of as indispensable. I think there's another side to that, which is, that which government looks at these associations and they think, well, the CRA actually brings a very important perspective because in the end, they're the experts for 6 million people currently, or maybe give or take a few, living with a form of arthritis. So, there's all these external perceptions of what you're doing. Yeah. And I think on the whole, they're very favorable. We really, at Arthritis Consumer Experts, we couldn't do our work without your membership because they are the experts.
Right.
And I don't think I've ever gone to one of them and they've said no.
Yeah.
They stream in here and they're willing to be interviewed and.
Rheumatology attracts a certain breed.
They're amazing, hey?
Yeah,
they're really amazing, and I'm so glad to hear that those spots are being filled now. I assume you intend to keep a close eye on that because you don't want to slip backwards.
Absolutely. Yeah, I mean, we still have a long way to go. But the problem is the population has grown, but the number of spots did not grow.
Has stayed the same.
So we're not really, if you think about it, it's like a leaky bucket syndrome, right?
Yeah.
We're adding a bit more water, but we're still draining.
Some spilling over. Yeah. We could go on all day. It's you lead a dynamic organization. You yourself bring a really interesting, unique, and valuable skill set to, I think, the rheumatology community, Ahmad, which I think those of us leading patient organizations really appreciate so much. We did get down in the trenches and talk about tough topics and, try to see eye to eye and build bridges together, which has been great. And so thank you so much for coming in. We're just going to see if there's any questions from the audience.
Absolutely.
And then we probably guess there's a lot of business that you need to look after outside the studio.
Where do you see digital health in 5 years, 10 years?
That's a great question.
And a passion of yours, I know.
Absolutely.
Yeah.
This is a sort of a side project for me. I think the biggest breakthroughs are going to come from the merger of the human and the machine interface with all the AI, artificial intelligence work that's happening. And there's a lot of fear that this might replace doctors and whatnot. I actually think it's going to augment big capacity of doctors
Yeah.
from a diagnostics perspective, from even counseling patients. This is the biggest impact. I mean, there's also some other technologies like blockchain for identity management and EHRs and PHRs, but I think the biggest impact personally is going to come from artificial intelligence.
Wow, which is controversial a bit.
Yes, it is.
But I
There's
think
a lot of
probably,
ethical problem with that
yeah,
too.
exactly. I think groups like the CIHR, which is Canada's largest health research funder, and they're looking at what's the impact of IA, what are the ethical issues related to artificial intelligence. But I think having an open mind and trying to get our heads around how we maintain personal touch and the human to human bridge, and find the way to let digital health, machinery,
Right.
things like that augment, support what it is we're doing, kind of human to human.
Yeah.
I don't think I want a robot treating me anytime soon.
I don't think, and I don't think that's what's going to happen. I think
Yeah.
it's just we're going to create a new breed of super healthcare providers by
Really?
augmenting their senses and their brain capacity, and
That's a whole nother interview, young
Yeah.
man. Other questions, Anita? No, that's good. Okay, we'll have more that come in and we'll fire them your way. If we can't answer them we won't speak for you, but if there's something simple, we'll,
Sure.
such as the website address. Website address, www.rheum.ca, RHEUM.ca. There's all kinds of information there if you're a professional, if you're sort of an allied health professional, if you're a patient, check it out. It's really cool. So thank you, Ahmad.
Well, thank you for
Always a
having me.
pleasure, yeah. And good luck getting through the rest of the meeting.
Oh, thank you.
Yeah.